For 4 years in a row, a local nursing home has been cited for problems that could put patients in immediate risk of harm. So what can you do if you suspect your family member is being neglected?
They say you have to take action, and this morning we welcome back Jim Higgins from the Higgins firm to talk about what rights you have in cases like these, because so many of us, as we live longer, we have that. If not now, maybe down the road.
Sure.
Give us your thoughts. I know one thing they say is don't just rely on email, don't just rely on a phone call about grandma or grandpa or mother or father. They say on-site visits are key to go and physically look.
Oh yeah, you have to, and I think the home that's been cited, the Cornelia House, is a home that we've talked about before, which is a little unsettling. But in that case, I think what started off, it was somebody visiting, is my understanding, and found some things that they were concerned about and learned about, and started a complaint to the state, and that started this process.
Now, Jim, you've dealt with nursing home cases before. I'm just curious, how did it get to this point?
You know, it amazes me sometimes, because when it gets to this point in any of these cases that we deal with, it's usually not real complicated things. It's not like a medical malpractice case where something very complicated goes wrong and it's little mistakes. It's very simple things that puts a nursing home this place. It's generally not having enough staff in a nursing home to care for folks.
Yeah, because that leads to neglect.
Sure.
Which can also be termed as abuse in some cases.
They say statistically, look at that ratio of patients to the care. And when you go in looking for a nursing home, you got to check that staff ratio.
Right. Make sure there's plenty of people around, because that's the deal, and that's kind of a lot of things that were cited for in this case is you just don't want to leave people in their room, because a lot of these people are at an age or at a point where they need somebody to help them get some water, to help them out of bed, to help them go to the restroom or whatever it is. And you got to have enough people there to do that. It's not hard things, but get the people there.
Jim, what do you need to observe when you go in there? You know as well as I do, there are times when the person they're caring for does not have the ability to communicate with you properly, and you would question it sometimes.
Sure.
But what do you need to look for to insist that you bring, to insist to somebody that things change, and then who do you call?
Well, what you look for, and then we list things on our website that are common to look for, are again basic needs thing. Is it clean? When you come in, are they eating? Is there any dramatic weight loss? Are sheets clean? Are they getting plenty of water? The simple things are the most important.
Visually, you can notice a difference.
Oh yeah, you can tell. And are they clean? Have they had a bath? Is their hair combed? Things like that. Just are they being taken care of if they can't communicate you? And like I said, if what you do, if you notice that it's not, you can do a couple of things. I think one, like anything, you start at the top. You go to the administrator, you go to the director of nursing, and say, hey, what's going on? You come to the nursing home not at set times. If you come at 3 on a Friday one time, you come at 8 in the morning on a Tuesday the next time. You come unannounced. You can also call the state of Tennessee Department of Health, and you can talk to them about it. They can help.
And they say, too, you've got to document and kind of be a watchdog. Because nursing homes are a business, and it's not a bad thing to be a business, but you've got to go in and say, all right, I'm going to go, like you said, unannounced, and document things. As you report to the person, write down what you're seeing. Because it is just, I was trying to think of the nationally, 1.5 million Americans are in nursing homes. And that was a statistic even from not 2007. So more and more of us are going.
And that's growing.
You mentioned go see the administrator and all that sort of thing. My question would be, and I would have my concerns, should you consider referring your loved